welcome everybody to the second session with Dr. VetTriage. I'm Elika Lenzaki. I am the chair of the Professional Wellness Committee. I will be moderating this session. And please set your mobile phones to silent and refrain from taking pictures of the presentation. You can enter your questions in the application and then click the green button to submit, or you can approach after the lecture, you can approach the microphone to ask your questions. The second session is leverage teletriage and teleadvise as a powerful solution for after-hours ER services. For the sake of the newcomers, I'd like to introduce Dr. Shadi VetTriage again. Dr. VetTriage attended Cornell University, where he received his Doctor of Veterinary Medicine degree in 2006. After Cornell, he completed his internship at Angel Animal Medical Center and then at Long Island Veterinary Specialists. He also completed a residency at Long Island Veterinary Specialists in 2012, becoming a diplomate for the American College of Veterinary Surgeons. In 2017, he created VetTriage and currently serves as the Chief Medical Officer. Shadi has been published in scientific and medical journals and enjoys lecturing to a variety of audiences. So, Dr. VetTriage, the stage is yours.
Thank you. Thanks everybody for joining, especially those who were not in the first one. Glad to have you. So this talk was originally made for equine practitioners, but it's going to apply to any species that you practice with. I chose equine for this talk because they really are struggling with after-hours emergencies and on-call, and so is small animal, but equine especially is really hit hard. And we tend to, at these conferences, tend to not put as much attention to them. So this applies to everything, but that's why it's heavily equine focused. I want to start with some quotes here. The expectations, standards, and history within equine veterinary medicine, and it's really any veterinary medicine, were built by hardworking, task-oriented perfectionists who laid the groundwork where few people these days care to walk. Horse owners need to be aware of the equine veterinarian shortage, as they are a key to the solution, making the work fit the workforce rather than making the workforce fit the work. And that speaks to our work-life imbalance that we're suffering from. Clients are bonded to the practice, not to a practitioner. Increasing horse owner regard for the value of equine veterinarians is needed. The use of first names, the liberal sharing of personal cell phones, and 24/7 access without boundaries has eroded some aspects of veterinary medicine. We all know this. If you're on call, whether it's small animal or large animal, everybody has your cell phone number. They don't use the word doctor, they just John or Mary. There's no boundaries anymore. And because of that, we have now created a storm that we are dealing with. And during COVID, this storm was accelerated, but it's always been there. COVID just sped it up. One more. We need to create a culture where equine veterinarians are respected. Clients need to set up appointments to have mental questions answered. Veterinarians need to stop allowing clients to dictate their medicine, and they need to deal with their fear of losing clients. A bad client that doesn't pay you is worse than not serving the client at all. They allow clients to avoid payment and don't allow associates to refuse service or fire those clients. So who gets punished here? We constantly reward bad behavior because we're worried that the client is going to go down the street and take their business elsewhere. Who cares? It's like having a toxic employee. They're ruining the practice. Yeah, we always justify it. Oh, that employee is really good at this and that, so we can't get rid of them. Yes, you can. You can get rid of them and you'll find somebody better. It's okay. They're only going to ruin the whole culture, and that's where we're at today. And so we're going to go over a bunch of different principles regarding teletriage and teleadvice, because those are one very powerful solution to deal with these issues that we have in the field. I created VetTriage when I had noticed during my surgical training that pet owners were calling the front desk and asking, should we come in? And the front desk, not being medically trained, would say, if you're concerned, come in. Well, that created a problem because then clients show up. Instead, I thought, what if you had a business model where veterinarians did the triaging? over the phone, because this is 2006, 2007. We didn't really have video capability at our cell phones like we do now. And so that turned into VetTriage. Next thing you know, as we're launching VetTriage a year or two later, the pandemic starts. And the pandemic accelerated the veterinary shortage, the cultural problems we've had, the long wait times, everything became amplified. So when you look at the different categories of telehealth, there's telemedicine, teleadvice, teletriage. All of these things have their own definitions, their own boundaries. And so however you want to practice with telehealth determines where you're going to live. They all have their own rules. And these rules are also constantly changing, which is why talks like this are important. It's my job to stay up to date with these rules. And unfortunately, the folks who are in charge of us, medical boards and organizations, are very slow to move forward. And they don't communicate very well. And so everybody's confused and they don't know what to do. And so they're afraid of telehealth. So I'm going to try and break it down and give you update information on it. So when you look at telehealth, that is simply the overarching term that accompanies anything that's virtual. You have a practitioner or a healthcare provider at one location, and you are talking to a patient or a client at another location. You're geographically apart, and that's telehealth. Underneath telehealth, there are a variety of different categories. We're going to focus on teletriage, which is, do you have an emergency or not? Yes or no. Teleadvice, what advice can I give you? Well, there are two categories of telehealth. And so when you talk about platforms like this, you want to decide how you're going to structure it, right? If you look into telehealth or you provide telehealth at your own practice, everybody does it slightly different, but how you do it matters. So are you going to have a software? Are you going to have like an app, or are you going to have browser-based? Are you going to have non-video or asynchronous? Are you going to have video or synchronous? Are you going to practice it within your hospital or outside of it? Are you going to be in real time or not? Asynchronous are things that are delayed, like text messaging and email. Synchronous are live, phone call, video chat. Are you going to use veterinarians or nurses or both? Are you going to have specialists or general practitioners? What type of telehealth? Triage, advice, teleconsulting, telementoring, species? Who are you going to take care of? What hours are you going to operate? How are you going to handle medical records? How are you going to handle compliance and confidentiality and cybersecurity? These are all things to consider when you're talking about this, which is why our numbers are like this. We've put in a lot of resources to make this what I consider the gold standard for teletriage and teleadvice. We have 200,000 sessions. We've operated in over 20 different countries, taken care of over 50 different animal types. I've got maybe 80 doctors on staff, about a dozen support staff now. We are 24/7. We partnered with facilities, rescues, universities, emergency hospitals, small practices, solo practitioners, clinics. We launched VetTriage Espanol in 2022, Equine in 2023. We now have VetTriage Pro, which is telementoring and teleconsulting, and then we publish papers as well. We actually offer also not just English and Spanish, but also French and Arabic on the platform. So when you look at the stats, and again, this is all equine focused, but the point remains, when you look at the stats, 80% of horse owners rely on veterinarians as their source of information. And I would say small animals probably like 100%, right? Small animal people are very reliant on their veterinarians. 42% of horse owners consider them pets. 47% consider them as family members. On small animal, it's like 100%, they're family members. Some do work, of course. We got canines and on the farm and things like that, but most of them are pet owners. And clients choose their equine-based vets based on who can get to that facility, which is, of course, unique to a large animal. You need a veterinarian to come to you. And so that's a huge factor when they're choosing a veterinarian, but the problem with that is now you have veterinarians who are on call 24/7. And so when you combine that type of life or work-life imbalance with our veterinary shortage, you have a problem, right? We have the highest number of vet schools in our veterinary history, with the largest number of veterinary classes in our history. The number of veterinary applicants continues to go up, and yet we still have a shortage of veterinarians. And why is that? My thought is they graduate, they get into their first job for a year or two, they hate it, and they leave. It's as simple as that. I have no other explanation for it. And when you combine that with the millennial workforce and now Gen Z workforce and their mentality, they are not going to sit in a job that they hate. They don't care about having debt. They want to enjoy their work and they want to have work-life balance. And fair enough, that's the way it should be. So they're leaving. And so now we have a shortage. Suicide rates, obviously horrible. Our numbers are way too high. It should be zero for everybody, obviously. But compared to the general public, we are 2.7 times more likely to attempt. That's horrific. In 2023, over 50% of equine graduates left the profession within the first 5 years of graduating. That's horrible. That's horrible. We need to save our veterinarians. Staff turnover is a problem. 65% of job postings have no applicants. The burnout rate for veterinarians, 30%. Staff members, 50%. The challenges we face, mental health issues, debt, suicide, shortages, we have a high turnover. 23% in the veterinary field compared to the general hospitality industry of 12 to 15%. It's almost double. And of course, the new graduates, right? They don't have any mentorship. They have a large number of debts. They go into a practice and they're on their own. And that's not the way that they want to operate. Satisfaction with work-life balance in veterinary medicine, 39.6% compared to 61% in the general population. They don't enjoy the work, they don't find it invigorating, they have personal conflicts at work, they have debt, work stress, cyberbullying, the gamut. And so it's no wonder that we have veterinarians who are leaving the profession way too soon. And then of course my focus with this talk is emergency coverage. I mean, these numbers are on the equine side, but it just shows you how bad things are. It's amazing that equine veterinarians even exist. And they are going down in number. Less and less vet students are choosing equine, and they're retiring earlier and earlier every year. 35% have support staff on ambulatory calls. 50% have no support. Can you imagine driving an hour in the snow to a farm in the middle of the night, you have nobody with you, and you're going to talk to a client who you don't know with a horse that could be insane, and now you're by yourself, and you have to do some sort of choke procedure or whatever you got to do for horses. It's not right. 77% service an area less than 60 miles, 22% over 60 miles. Imagine that. That's your entire night. It's gone to driving, taking care of the horse, and driving back. In 2021, over 50% of equine practices have 2 doctors or less, so they're on call 50 to 100% of the time. If you're a solo practitioner, you're on call 24/7. That's it. If you're in an area that's rural, you are the only thing out there. The number of hours per week in the busiest quarter, in 2021, the graduates were working 68 hours. In 2020, 62 hours. 2019, 56 hours. Look at that. The numbers have gone up every year. How much money do you make from ER? Maybe you can say, well, you make a lot of money, so it's worth it. Actually, 25 to 42% don't make any additional money from being on call. Again, this is equine. 32% of them will receive 100% of the money that they're charging to the client, which usually is an emergency fee and travel costs. That's crazy. We're not even rewarding our veterinarians financially. So, all of this to say that with VetTriage, and the reason why it is not supposed to be a sales pitch for my company, we're the only ones who operate in this way. And so we have VetTriage for non-equine, VetTriage Pro for telementoring, and then VetTriage Equine. And so what we do is we partner with facilities. We meet on Zoom usually, or have a phone call. We give you a form to fill out, it's like a page or two. We don't have any contracts. We don't charge the clinic anything. The client pays us. And then we create a website for your clinic. We create flyers and individual protocol. You put the VetTriage logo on your website with this landing page, this website. You share the flyers. You change your voicemail and email, social media, and you announce it to your demographic like a week ahead of time. And then you partner with VetTriage. So here's an example of an equine session on VetTriage between my equine doctor and a horse owner.
They wanted me to call and work with this with you guys. So, okay. And I'm going to get my daughter to come out because she's actually the horse person. I'm just the mom. Okay, hold on 1 second. Yeah. Hey, Carson! Carson! All right, she's running out here with me. And I'm going to turn the video around so you can walk out to the pole right now. The vet's on here. Okay. That's the mama, right? The dark one. Okay. And then baby's taking a nap. He's been up and moving. I hear you Wednesday. I know. The vet is on the phone. We're doing a call with her to look over, to check out the baby. So hey, Kirsty. So we're gonna walk over now.
Okay. Can you tell me a little bit about the mare? How old is she? What breed? Is this her first foal?
This is her first foal. She's a quarter, and we're not quite sure how old she is.
Okay, and were there any concerns during the pregnancy?
No, ma'am.
And was the foaling observed?
No, ma'am.
Okay, so you found the foal this morning?
Yes, ma'am.
Okay. And did you find the placenta, the fetal membranes?
We did.
Okay. Do you still have those?
We do.
Awesome. Okay, so the foal is a few hours old, is that correct?
Yes, ma'am.
Right, and what's he done so far since you guys found him?
He has walked around, he's nursed, and he's laid around.
Mm-hmm. Have you observed him nursing, and did you notice any coughing or milk coming out of his nose?
We have observed him nursing, and no, we've not noticed any of that.
Okay, and mom is tolerant of him nursing?
Yes, ma'am.
Right. Would you be able to get a little closer so I can have a look at his belly and his umbilicus?
Turn his, pull his legs.
Well, and if, whatever he wants to show me, that's fine. It looks like you have some iodine dip on there.
Yes.
Perfect.
Okay.
And is there any swelling or discharge around it?
It does not appear to, so no, there's not. There you go. Does that help?
Oh, yeah, that's perfect. All right, thank you. Okay, yep, let's not get kicked.
Okay, King Philip.
All right, and it looks like if he wants to get up and walk around, that would be perfect.
All right. Good. You want us to nudge him to get up?
Yeah, it looks like mom's gonna give him a little nudge.
Come on, King Philip. Come on. Thanks, Wednesday. Could you make him get up, please, ma'am? Oh, no.
Oh, so hard to be a baby.
You want to help him up?
All right. If he wants to stay down for a second, if you want to show me his gums, that would be great.
Oh, hold on. No way. There we go.
Oh, perfect. And can you just press down on them with one finger? Looking for the capillary refill. All right, and let go. Looks good. Are they nice and moist?
They're pretty moist. It's a little dry, but nothing bad. Like,
Okay. That's good. They look nice and pink and healthy. All right, now if you want to give him a little butt scratch to get him up.
Come on. Oh, you're going to be a fun one. You're going to obey? It's a good thing you're so little. That's right. There, come on.
There we go.
Come on. Oh, baby. There you go. All right.
All right.
All right, Coach, move out of the way, buddy. Sorry, my phone, I have to move the opposite way so they.
That's okay. The video is coming through a little bit pixelated, but it looks like he's getting around pretty well, and I don't see any obvious contracture or abnormalities in his legs, so that's good. Looks like he wants to go nurse, that's perfect.
It takes him a little bit to find it, and he kind of gets latched on.
He's doing great for a few-hour-old colt. Have you guys had foals before?
We have not. This is our first one.
Okay, that's so exciting. Yeah, especially the colt foals can be a little bit slow.
Okay. Yeah. But he has nerves. There he goes. He's latched on.
Yep.
Get it, buddy? There he goes. I can hear him gulping now.
Yep, yeah, I can hear that too. That's great. And then we'll let him nurse for a second. The other thing I want to have you check for me if you haven't already is just run your hands down both sides of his rib cage and make sure that you don't feel any lumps, bumps, or abnormal movement in the ribs, because sometimes when they're passing through the birth canal, they can end up with rib fractures. And usually you'll feel like a little bit of crunching or some swelling around them.
Okay.
You don't want to do he's nursing. And he looks just a little bit in that left front leg. That left front leg looks a little bit contracted at the knee. It's not fully straight. A lot of times in the first 24 to 48 hours of their life, if they're up and walking around, their tendons will get stronger where they need to get stronger and loosen up where they need to loosen up. But if that doesn't start to straighten up in the next couple of days, you'll want to have somebody out to see him in person.
Okay.
There's the bandaging and different medications that they can give to relax those tendons.
Okay.
And that will last for a couple of days more.
Great.
The other thing that I can't do for you over the phone, but would be a good idea to have, do you have a regular vet who takes care of your horses?
Yes, we do.
Okay, so I would plan to have them out on Monday if they can, to check some blood work. They want to check what's called an IgG. So that's to check that he got enough antibodies from mama's first milk.
Okay.
Typically, if it's been a healthy pregnancy and an uncomplicated foaling, as long as they get up and nurse right away within the first couple hours of life, it's usually not a problem. But if they don't get enough antibodies, they can get really sick.
Okay.
So we like to check that in the first couple of days of life.
Okay.
And then
So it's a pretty straightforward consultation, nothing crazy there. The owner wants to know, should I be worried about anything? What should I look out for? And so our doctor does go on to check the vulva of the mare as well as the placenta and fetal tissues as well. So that's an example of a pretty kosher interaction. And so what we end up doing with our clinics who want to use us for teletriage and teleadvice, especially after hours, we have them fill out a form. They fill this out. It's pretty comprehensive, but it tells us everything we need to know about the facility and how you operate. We then create flyers. This is for Cornell University, for example, in upstate New York. And the flyers are handed out to clients, or it can be shared virtually or digitally with people. Here's an example of their website where they have a VetTriage logo, and people can click on that and then talk to our veterinarians to decide if it's an emergency or not. Here's a hospital in Hawaii, pretty website. You scroll down, there's VetTriage. They can click that link. There's a paragraph explaining how we operate. And so just an example of how the clinics will post us on their website. Once the client clicks on the VetTriage logo, they go to a landing page. This will be unique to your facility. It's got another blurb here with how we operate. You scroll down and the client fills out information. Email, first name, last name, phone number, what language, and then is it for a horse, yes or no. They click on that, they go ahead and they pay for the session. $75 US for equine, $50 US for non-equine. We do change the pricing depending on the country that we're operating in. And then they have to sign an agreement that says, remember, this is virtual and we are not establishing veterinary client-patient relationship. And so they click on this I agree button. If they want to expand on the information, they can. Once they do that, they can pay by a variety of methods. Click step 3 and they're all of our veterinarians. And so here's another example of a more of an emergency situation on the platform and how we handle it. This may or may not be okay with you. It depends on how you view this. For me, this is absolutely appropriate. We have so many cases of toxicities like this that we take care of at home.
Hello there.
Hi.
Dr. VetTriage, nice to meet you.
Hi.
What do you have going on?
A like 9-month-old puppy. This is her, and this is pretty embarrassing, but I think she ate one of my tampons. That was just
How long ago?
I think this just happened,
Okay.
and I just found this. Like she chewed it off the screen, and I just found that.
Okay.
And we just are wondering if we should give her hydrogen peroxide.
Yes.
For
We're going to do the peroxide thing. What does she weigh?
I don't find out. How much does she weigh? 16 pounds or so.
Okay, 50 pounds. We'll take her.
Yeah,
Yeah. So, and you have hydrogen peroxide at home?
we do. We
Okay.
have this topical solution.
Good. All right. So for a 60-pound dog, 30 kilograms, you're going to do the maximum allowable dose for dogs which is going to be 45 cc's or mLs, right? So my first question is, do you guys have a syringe at home, or do you like a turkey baster? A syringe is preferable, whatever you have.
You have a turkey.
Okay, so we'll do turkey baster. What we're going to do is for 45 cc's, hold on, let me think. Let me look at this I always forget to convert. 1 second.
Drink water right now because of the tampon. Well,
Say that one more time, sorry.
let her drink water right now. Just
No,
go.
hold on. Okay, let's just do, yeah, good, okay. Can you still hear me?
Yeah, can you hear me?
Yeah, perfect. So you're going to do 9 teaspoons.
9 teaspoons.
So take 9 teaspoons, put it in the turkey baster, give it to the dog. Now, if there's no, within 10 minutes, you're going to repeat the same amount again.
Okay, we are just getting everything set up,
Yes.
and then
Now-
we're.
After you get, if you have to do the second round, and there's still no vomiting, you're done giving the hydrogen peroxide. No more. Okay?
Okay, so
Uh,
9.
9 teaspoons,
Let me-
not tablespoons, teaspoons.
Okay.
Yep. And then give the dog 10 minutes before you have to repeat it. If there,
I'm here.
no, you're fine, you're fine. You have to do 45 minutes to an hour before it's too late. So don't freak out too much. You can take your time with this.
And then,
How many milliliters is it? It's 44 milliliters, right?
Yeah, 45.
Yeah. Okay, so you guys is 22 milliliters.
so we have this, last week had to do this before because she ate chocolate. Oh, I swear we're not.
You guys hear me okay?
Ended up losing them after that, had to call them to go over the rest of the instructions for them. But that's a common situation. The dog just ate the tampon, they just ate it. We know tampons can wreak havoc in the GI tract. Can we actually induce vomiting at home and save them the trouble, the stress, and the finances of going to the ER? They ended up emailing us saying the vomiting was successful, the tampons came out, we're good to go. And of course, we give them advice what to do after that because they have to deal with the gastritis from the peroxide ingestion, right? So we take care of them. In fact, clients can access us after they're done with our session for as many times as they want at no additional charge for 5 days after the session is completed. So after they pay that initial fee, they have us for whatever questions and concerns they have. So if the patient did not vomit or got sick or whatever it is, we can take care of them. And so that's the whole process of how we partner with facilities. All of our cases, well, 88% of our cases are all referrals. They're all referrals. The other 15% are coming from Google searches and word of mouth and what have you. So here's an example of a protocol from one of our partner hospitals that are located in Oregon in the US, and it just shows you how comprehensive it is. We have all this detail for how they want us to operate. Here's another facility in Pennsylvania, same thing, mixed animal. They have all these different rules and stipulations we want to follow. Another example as well of a facility with a bunch of stipulations in red, and so we follow it is how they want us to operate. And so we handle all of our after hours for mixed animal for these facilities. We also have bundles in our system that we share with our veterinarians. They can customize these advice for common issues. Again, I'm showing equine, but we have small animal, exotics, avian, etc. And so colic, for example, wounds in horses, for example. All these are advice that our veterinarians can tailor to whatever the client needs. We want to make sure our clients are not rushing the client off the video, but also can be efficient with the paperwork. Foaling, choke, all common issues there that we deal with. And then we send a summary. This summary has the client's information, the pet information, the medical summary. Did we recommend emergency care, yes or no? And if we did not, when should they see their veterinarian? Everybody has to go somewhere. They don't stay with us. We're not a clinic. We're not an online clinic. You either go to ER or you're going to your family veterinarian, but you're not staying with us. And most of them, over 80%, go to their family veterinarian and avoid the emergency visit. And then we have, of course, a bunch of symptoms to look out for, a way they can reach out to us at no additional charge, and of course, legal disclaimer to make sure we are protected. So here's an example of that foaling situation. The horse's name is Wednesday, and this is the write-up that our veterinarian had for that client. We will share this summary with the client as well as with the clinic. And she has all this information here for how to take care of a new foal. It's all in our system. Our veterinarian takes less than a minute to make this stuff up. They just have to customize it, whatever they need, and then send it off to the client and to the clinic by email, and the clinic can then attach it to medical records. So in summary, this is the current workflow. If you're on call, doesn't matter if you're equine or small animal, if you're on call, you have a client that has a concern, they call either the on-call doctor directly or they go through an answering service. Answering services, of course, are inefficient and expensive and don't really solve your problem. And having an on-call doctor means they're getting every single phone call. And then the doctor takes the calls and you decide if it's an emergency or not, and then you act accordingly. And the problem with this, of course, is not sustainable, as you can see with the current challenges we have in the veterinary profession. The hospital team is not getting enough rest, burnout, and difficult to recruit. In fact, we've been leveraged by our partners to recruit new veterinarians. They'll tell them, look, you're going to be on call. We live in Juneau, Alaska. There's nothing else around. But you only get called once or twice a week. And it's by a veterinarian. VetTriage will triage for us. So it makes their workload after hours much more digestible. The cost outweigh the fees earned from the emergency care. When you're talking about paying for answering services, we're free for the clinics. There's no revenue generated from answering calls. Anytime you get woken up in the middle of the night, even though it's not an emergency, you're still woken up and you didn't get paid for it. And now you've lost some sleep. And then you have to go back to sleep. And then you get woken up again 30 minutes later with another call. So we're trying to solve these problems. And of course, there's safety concerns, especially on the large animal side, when you have to drive to somewhere that you don't know, to talk to a client you've never met before, for a horse that you've never met before. Whereas, if you partner either with us or have your own teletriage, tele-advice service, whatever you want to do, the client now contacts VetTriage, and if it's equine, they'll talk to an equine vet, otherwise they're going to talk to our other vets, and then we determine if it's an emergency or not, and act accordingly. And if it's not an emergency, which is the majority of cases, we're going to give them advice and monitoring parameters, and they can follow up with us as much as they want until the family veterinarian is open again. If it is an emergency, we follow that hospital's protocols. We call the on-call doctor, or maybe there's nobody on call, we call the local emergency hospital and refer the case over. We want to make sure we hand that case over to somebody. We do the phone calls for the client. We don't have them call the ER hospital to be seen. And if it's an on-call situation, those clients are not getting your cell phone anymore. We take care of that part. So this allows hospitals to get rest. The on-call doctor is now only contacted for true emergency cases. This expands access to care for hospital clients. It avoids unnecessary emergency visits. It improves workplace culture and recruitment efforts. Provides a tailored after-hour solution for geographic and other challenges unique to the hospital. This is because we tailor-make our protocols based on how you operate in your area. So we've organized flights for people, we've organized ferry rides for people who have to go to ER and there's nothing in their area. We've kept GDVs alive for a weekend, we've kept black cats alive for a weekend because we can at least educate them and use some novel ways of taking care of that animal who's obviously critical. Nobody's saying these animals should stay home. A hemoabdomen has to go in. A black cat has to go in, but there's no option for these folks. The next plane ride or ferry ride might be 2 days later. So we have to keep that animal alive for 2 days with a GDV at home. We've done that. It sucks, but we have to do it, right? It's where these people live. There's no other option. So when we do partner with facilities, then it helps with the staff shortage problem. It helps with the hospital culture issues. We've actually helped keep hospitals open that were trying to close because they just couldn't do it anymore. And then for the new graduates, it helps them. What's really cool about this part is that let's say you have a new graduate that you just hired them and they're on call for the first time, when we call them, we have the case packaged for them. They can now think ahead of time what to plan for that choke, or how to plan for that GDV. They can now envision that. They're not just trying to work on the fly with that client. Remember, they're new graduates, they're inexperienced, they've never seen this before, right, outside of school, or maybe an internship. So it helps package the case for them, makes them feel way more comfortable with the case. And everything, of course, is customized for your facility depending on how you operate, whether you're in Australia or the US or Canada or the UK. We'll take care of your clients and operate how you want us to operate. We don't worry about veterinary client-patient relationships because teletriage and teleadvice does not require it. In fact, most laws and regulations don't even mention these words. We're so outdated when it comes to regulations on this front that if you look at any laws in most areas, not all, in most areas, maybe they'll use the word telehealth. Oftentimes, they're using the word telemedicine to mean telehealth, which is also incorrect. Telemedicine is a subcategory of telehealth. Telemedicine is not the whole thing. Telehealth is the whole thing. And so we know based on the verbiage that organizations are just far behind. Your clients should not be relying on you, they should be relying on a veterinarian. And so we should trust our veterinarian to use their judgment to triage for you. The client does not need you and your staff. We want you rested. And that way when you come into work the next day, you're ready to tackle the day. So the client signs up, it takes them a minute to log on and pay, and they're on with our veterinarians. Our wait time on average is a minute and a half. A minute and a half wait time. And then, of course, your clients that are used to calling you directly, which is a very common equine concern, we got to stop that. They should not have access to you 24/7. You don't have access to your own physician 24/7. Why are we giving it to our clients? And we're not even charging them for it. It doesn't make any sense. And so we have to take control of this. Clients never skip us or skip you guys to use VetTriage. They just don't. Even if a client used us in the past and they love us, they're still going to want to talk to you first. They always want to go to the veterinary clinic that they're familiar with first. They always do. They trust you, and they should. And if you're not available, then we're a good plan B. Like I said, all the protocols are unique to the facility, and any follow-up questions and concerns by the client. I get a common question all the time: how do you prevent something from happening? Let's say that vomiting dog turns into a GDV. How do you handle that? Well, the client can call us or email us anytime, 24/7, without paying again. And then we'll re-triage the situation. Sometimes the plan changes. That case that was not an emergency 3 hours ago is now an emergency. We have to switch gears. Or maybe it's still not an emergency and they just need extra hand-holding or extra advice or whatever it's going to be. A lot of facilities will say, well, we triage our own calls coming in. The problem is you don't have eyes on that patient. Most often the triage is being performed by a technician or a nurse, not by a doctor, right? And in some places the receptionists are doing it. That's inappropriate for many reasons, obviously. Why would you want to put your hospital at risk for triaging over the phone when your staff, their hands are most valuable taking care of the animal, cage side, right? Medications and surgery and anesthesia and monitoring, that's what they should be. They shouldn't be on the phone triaging for free, putting your hospital at risk. There's no point in doing that when you have a service like ours that's video 24/7 with veterinarians. There's just no reason for it. You're putting yourself at risk. It's inefficient use of your team. You're not even charging for it. You want to have your staff on the floor taking care of hospitalized patients or incoming animals. I had issues with scales like this. A lot of facilities will try to use this to have clients kind of triage their own cases. I'm not a fan of that. An example would be something like, let's say for example, you have one that's, let's go with like a decreased appetite, right? Level 4, not urgent, according to this scale. Well, if you have an obese cat that's inappetent for 3 days, you don't know if hepatic lipidosis is set in. The client has no idea to look for that. They're like, oh, okay, decreased appetite, not an emergency. It's only been 3 days anyway. Now you have a yellow cat, right? That doesn't make any sense. The same thing happens with blocked cats. How many pet owners call you up and say, my cat's constipated? They're constipated when they actually have a urinary obstruction. The client doesn't know. You want a veterinarian to sift through that. So scales like this, although I get the idea behind it, they just don't work. And really, for me, severe trauma, getting hit by a car. We see plenty of hit by cars that are stable animals. They don't have to be seen, or at least they don't have to be seen that night. They should be seen the next day, right? But not that night to wake you up at 3 a.m. So these scales don't really work in my opinion, and I think you should have a veterinarian perform the triaging. So I went through, of course, the workflow. After us, we would send the records over to the client and to the facility. And even for folks who are unfamiliar with technology, we have a VetTriage phone number they can call. If they don't have internet or they're not tech savvy, they can call our veterinarians. They can pay over the phone and then speak to our doctors, and we can do a phone session instead. So either way, it works for those areas. All the liability is on us, and I am the one who actually interviews and trains all my doctors. I'm a board certified surgeon. I'm a specialist, so I have a high standards that I expect my veterinarians to have. I found out that veterinarians have to be at least 5 years out of school to be able to even handle this kind of work. And most of my doctors have been in practice for decades, and they've owned practices and sold practices. So anyway, prescriptions is a whole other topic that we can always go over. This is an area that I'm in favor for, but it involves trusting our veterinarians to make the right decisions here, and not everybody's cool with this, which I understand. Over-the-counter products or medications the client has at home, they have access to, we will leverage those things. Those things are already there, they're available. I'd rather our veterinarians dictate how to use those products rather than the client going online and then misusing those products. And this is just a nice feel-good, thank you for your excellent evaluation of our dog. You are correct in your intake and thoughts about how we should support and care for his injury. He made a miraculous recovery by the morning. He's running, attempting to pull off a naughty jump on our bed this morning. He's mended to the point where we are certain that a follow-up or wonderful bed is not needed, although I did speak to his office today. I also congratulated them on their selection and use of VetTriage for after hours. And so this is very nice. We hear this all the time from practices and from clients that they enjoy using the service. So I'll stop there. This is my contact information. This is a QR code for VetTriage, and I'm happy to answer any questions that anybody has. So thank you for your attention.
Thank you, Dr. Vettriage. Please come forward with your questions.
Hi, thank you for sharing all of this with us. My question is if you have satisfaction surveys both for the tutors but also for the veterinarians. How has been your experience, and if you have over the years gathered that information?
Yeah. So with VetTriage Pro is our telementoring, teleconsulting platform. We launched that this year, and the majority of our partnerships for VetTriage Pro have been large corporations that have been taking all their new hires. A lot of times they have interns and having them use us as a perk, as an employment perk. So it's $100 US to talk to our veterinarians on live video, and our seasoned veterinarian to help mentor that new graduate through a case. And so they won't charge the client for that. Although we have some facilities that will mark up the cost and charge the client for that telementoring, teleconsulting service, which is at their prerogative. We have no say for that. So that's how we manage the VetTriage Pro aspect to it. $100 to VetTriage, they can mark it up or not, and most of the larger practices just don't. They want to use that as an employment perk, saying, hey, we recognize you're a new grad, you value mentorship. Although we can't have somebody on the floor with you, we have this service that you can use whenever you want, anytime, and they'll mentor that way. That's been hugely successful. It's awesome. And the idea with VetTriage Pro is that you eventually don't need to use it again, right? You want your doctors to become more and more experienced to the point where they don't need to use this anymore. Maybe once in a while, but that's it. That's the idea, is you wean them off of us over time as they get more experience. So that's how the telementoring, teleconsulting has been perceived so far. And as far as I know, to date, it's the only one of its kind as yet, without specialists. They're mostly general practitioners and emergency doctors who are on that platform. Did that answer your question? Oh, satisfaction survey. Yeah. So we tried in the beginning, when we first started this, having satisfaction surveys, and they were ignored. Nobody wrote anything. And so what we do now, we just have at the bottom of the summary, if you want to share your thoughts or testimonial, please do. I would say maybe 5% actually do. And we all know this. We all get surveys from companies, we ignore them all the time. And so when we do get feedback, they're overwhelmingly positive. It's very nice. And so I share it with the team and say, hey, good work, and I tag the doctor that was involved with that case and what have you. But we don't have an official survey because they were just ignored, and it was a waste of our resources to keep doing it. So we also, by the way, on that same front, we don't do follow-ups. We will not call an owner up 1 or 2 days later to see how Fluffy is doing. We don't do that. And the reason for that is I don't want to be seen as though we are establishing a relationship with that client. I don't want that. I also don't want the client to think that they can just use us free all the time because their vet costs money. We want them to go back to their vet. Go back to the vet and pay your vet for the services. We are not your vet. We are just here to help you figure out triage, advice, and then go. So we don't do any follow-ups, proactive follow-ups like that at all.
Okay. Thank you. We'll take one more question, please, because then we need to prepare the room for the final session.
Just to part answers that what you just said about the satisfaction surveys. I work for a Swedish telehealth company, and they do, following each call, they send the clients sort of a survey, or give them the possibility to give you a star review, and also to write comments if they want to, and that's actually quite high through the success rate.
Nice.
The point I would like to make though is how do you handle that with the insurance and liability insurance side of it? Because what we have in this situation, we saw that with the horse owner, and also, I mean, when we deal with dogs and cats, we have animals who are distressed, and we have people who are not skilled veterinary technicians or veterinarians, yet we employ them actually as our sort of hands to handle these animals. Does your company provide a liability insurance in case these owners get them bitten or kicked by the horse or injured or something like that? Because you see, that is I think it's a problem.
Yes, thank you. I love it. Thank you. So when the onboarding process for our veterinarians is quite extensive. We have many protocols they have to follow, and they're trained. And one of the protocols above many are making sure that if we think that the pet is not handling the examination well, abort ship. Just abort mission. If the animal is trying to bite, or you can tell that the animal's fearful, just don't do it, right? Just don't do it. And so that's made clear to our veterinarians to not overextend what the client can do. Some clients, very versatile and competent. Other clients, they can't do anything with their pets. You're just looking at them from a distance under a bed with a flashlight, and that's the best you can do, right? So we want to make sure. Thankfully, again, knock on wood, nothing's happened. As far as the liability part of it, we have company company liability insurance, and all of our veterinarians have their own individual liability insurance. And so right now, as it were, if it were to be a complaint or an incident, it would go through the company first, and then so the company would handle that. We've actually had 3 situations like that, all of which we've won, because it was a non-issue. And most of those 3 complaints came out of medical boards that I'm familiar with. They're fearful of telehealth. They're looking for something. I'll stop there with that, but it has happened 3 times in over 200,000 sessions, so it's really rare, and the company just takes care of that sort of thing. When we started this company, I told my business partner, who does the business side of this, 2 things. We need publications, we need research papers, and we need lawyers. That's it. That's the only way we're going to be able to survive in this field, because we're the first ones doing it in this way. Some veterinarians are not going to like what we're doing, and that's the nature of starting something new. So I appreciate that question. That's the reality of it. Yeah. Thank you.
Thank you very much, Dr. VetTriage. I'd like to also thank the audience. For those of you that are here for the last session, please give us a couple of minutes to set up the room, because we have a panel discussion.
So some of it comes down to individual veterinarian, right? I meet everybody on live Zoom or video. I want to see how they interact on a vertical scale. But on paper, I like at least 5 years of experience. And whether that 5 years is ER or GP, although it's nice to have either some ER experience, or if you don't, maybe like 1 year general individual. It's nice. But again, those are all like up in the air. I've had some veterinarians who've done all that, and still I had to let them go because they weren't adapting to this, right? So, but at least 5 years out of school, I did it with some sort of emergency experience. Well, it depends on how you prepare yourself. Yeah. But I asked for a resume or a CV any time I can look and see. And the rest of them down to put it around me. There's always a Photoshop me and do this.
Team. Okay, so you sit there. First, Misha will sit next to you. Then I think it is Angie. Then it is Tommy, and finally it is Carol. There's Carol.
Who will answer first?
The first one.
You.
Yeah. You don't want to? Yeah, I can change your turn. If you want. No? Are you sure? Okay. You are sitting on the panel, lady. Come on.
It depends. So you're from the UK? So it's weird because you guys were like at the forefront. You were subscribing and doing all this. And now it's like the opposite. It's wild. Because I have some UK vets. There is taxes. No. You can, you should. Yeah, no, it's so crazy. It's so stupid. No, so for us, we think prescriptions up to the individual partner clinics. If the partner clinic wants us to prescribe stuff, then we will do it. 99% of them don't want us to, and so we're fine with it. Or if the client has no value, and then has out, then we'll certainly. I would say on a monthly basis, we see thousands a month. Number of patients that have prescriptions per month, 0 to 1. It's really weird. Now that seizure I mentioned, that's one where if the client has no purpose, I will try to go with some Petra or Valiant or whatever. Most of the other ones are like Hotspot or something. We'll get them which is an online pharmacy, and they'll ship straight. We also need prescribing stuff. Not prescribing actually. Over the counter and medications that have a more different. If somebody from the UK calls us, they have to have a Penton at home, and we're going to use it. But otherwise, it's prescribed. I would prescribe outside the US, but that's getting a bit false. And now I'm like, all right, I don't know if I want to do it. Yeah, I am licensed to get shots in Canada, and 30 states. Where are we? Yeah, they're going to get calls from everywhere. Yeah.
So for example, we just want to.
Welcome everyone for the final session for the day, which is a panel discussion on perspectives on professional wellness. So before we start,